exciting opportunities in the life sciences sector at the moment is the convergence between clinical and biological and digital data. And the scope for us now to really dig into the genetics of causes of disease, together with large data sets where we can really interrogate the biology and then use those data sets to find patients with the diseases. And then you can really start to develop drugs for the right patients at the right time in a much more coherent way. That is really exciting. Well, Europe can compete, and I would say specifically also the UK can compete in clinical trials. We were shown during the COVID pandemic that the UK was able to run world-changing clinical trials on the COVID vaccines quicker and faster and nimbler than any other country in the world. And those data sets then went into regulatory submissions around the world. So I think clinical trials and joined up electronic health records with patients and diseases, and then using that to then bring the right patients into clinical trials is somewhere where I think Europe can really compete. But of course, Europe also has many of the top universities in the world, and a lot of the great new drugs have been discovered in UK and European universities. The lessons we learnt about the UK's strength in life sciences post-COVID was very much about collaboration. So we had a lot of brilliant academic scientists, for example, the Oxford team, that were able to work with industry and work with the government to get a vaccine out quickly from the test tube through to population scale vaccine distribution in less than a year. Now, there are not many universities in the world that can do that, and that could only have been done through incredibly effective collaboration, and not just collaboration in the UK, but collaboration with relevant institutions and groups on the continent in Europe and in the US and around the world. And that is something that I think has been hugely exciting. SV has a team both sides of the Atlantic, so in the UK and in the US. And that's got a huge opportunity for us because it means we can build our companies quickly, cheaply and nimbly in the UK and Europe. And then when they get to that point where they need to raise substantial funds and start to think about going public on NASDAQ, it means we can then work with our US colleagues to really make sure that they get proper access into the US markets. So having that bipedal approach for us has been hugely helpful, but also it's useful for part of building our companies. So even if we may start with some European technology and build a company around that, being able to access the US and to be able to think about, are there any complementary technologies or approaches we want to combine, and have a team that can basically help source those ideas is also helpful. I think the key trends investors need to pay attention to is how to use the data that we've got out there and the data that's emerging, both digital, clinical and biological data, to invent and develop better drugs. Because the fundamental issue that we face is that our healthcare systems are going to go bankrupt around the world because we have aging populations, and the diseases that mostly are not cured and are expensive to treat. And we need to completely change the way we think about healthcare and healthcare delivery, and how to identify patients before their disease gets too complex and too expensive. And so the sorts of trends from an investment perspective is, how can you identify those patients early, intervene and ultimately cure disease?